Hello, and thank you for participating in this lesson entitled Workload Management. Today we will examine techniques to improve patient care through employee safety and enhanced quality standards. These are the learning objectives. Identify 3 challenges nurse administrators encounter when implementing evidence-based care. Implement ideas to track quality in healthcare through the use of charts, run charts, for example. Provide examples of programs used to implement quality, and recall scientific theories that apply to the nursing practice. But first, what is evidence-based care? This concept focuses on providing the best up-to-date care using sound research with proven results. Given the rate at which medical knowledge is multiplying, I think it's by like 5 times every year, it would not be reasonable to provide care based on what was learned in nursing school. The moment a graduate obtains their diploma, much of the information learned will need to be revised. For years, the CDC has changed their recommendations on how long an indwelling catheter should remain in. So imagine giving care with outdated knowledge on this topic. An unnecessary infection could develop. The provider team wouldn't have a leg to stand on if the CDC doesn't back their current decision. Fortunately, we live in an age where timely, accurate information is available to staff through online scholarly resources. Any nurse can find information and bring it back to the management team for review. Nurse leaders should be welcoming to new information that could be used to revise outdated policies and procedures, as it will lead to better care and less liability. Why provide evidence-based care? Evidence-based care creates an environment where research drives the care rather than tradition. Traditions become outdated. Surprisingly, evidence-based care leads to a reduction in costs. This becomes critical in an environment where value needs to be maximized along with cost containment. Today's quality measures demand that facilities focus on quality rather than volume. With many hospitals providing online access to research libraries, there's no excuse why any team member from management to bedside nurse can't find information to enhance the level of care they're giving. According to Ledger and Dunham Taylor, only 15% of the nursing workforce uses evidence-based care consistently. Evidence-based care helps keep pace with technology. Any new piece of equipment that has been approved for use on the market will have been used through extensive testing and approval processes. Although possibly more expensive, new technology could provide better options for better outcomes. What are the challenges to implementing evidence-based care? There's a saying that if you want to start a new habit, you have to do it for about 66 days. I got that from Healthline. Knowing this, it is not surprising that it takes a focus manager to change a culture and create new habits. If staff have a desire to implement evidence-based practice, but management does not, it creates a catch-22 situation because policies still need to be followed or corrective action could result. This is why the environment of change must come from the top. Mid-level managers, surprisingly, have the greatest ability to influence change. They're the groups that see the patient care through the eyes of the floor staff and through upper management. They bridge the gap. New information can climb the ladder faster through mid-level leaders like us. Steps to implement evidence-based care. Implementing evidence-based care starts with small steps. So begin incorporating evidence-based care concepts into the weekly, monthly nursing meetings with staff. Present online sources or updated textbooks for staff. Show them where they can be found. Create a culture where staff feel that they have a voice and every opinion matters. I found that when conducting interviews, this is the time to explain the culture and the expectations. For instance, I always discuss the attendance policy during interviews. Staff that are in school are less likely to research evidence-based practice guidelines anyway. The staff that are in school are likely to research evidence-based practice guidelines because they're in school. These staff could have a lot of experience already bringing to the table these concepts into the workplace. Managers are bombarded every day with complaints from staff. Use this as an opportunity to challenge them to find a solution to the problem that they bring forward. Not every solution has to be placed back onto the managers. So for instance, when someone comes to you, say, okay, what do you think the solution is? And then look into whether that is realistic. Use of run charts to improve quality. Run charts collect data over a period of time that can be used to predict trends or compare other data. Utilizing run charts will give the ability for the data to be tracked over time and for changes to be made. So it compares data before and after. The more data available, the more meaningful the data will be when interpreted. A trend is defined as 6 or 7 consecutive increases or decreases in the data. Collect data that can be charted on a grid. So the y-axis could be the numerical data, the x-axis being the amount of time passing. To find meaningful data, collect at least 20 to 25 points before creating the run chart, says the Minnesota Department of Health, my best friend. Then there are control charts. These differ from run charts in the sense that they establish high or low bars that should never be exceeded. By comparing data, one can view variations in procedure to see if it is consistent. Control charts are especially useful for determining issues as they occur or patterns of variation. When starting a control chart, the data may appear out of control, so do not establish a high or low until at least 20 data points have been established. For example, a control chart could help HR track OSHA-related injuries from year to year. The chart will track the injuries sustained, evaluate if certain months have more injuries than others, and determine if the number of injuries are outside of the desired range. You ever heard of lean thinking? Lean thinking is the process of doing more with less, fewer resources with less waste. The processes we create are sometimes able to be simplified, especially in an era where value trumps volume. Making cuts will be necessary. The lean process never ends, it's continuous. The goal of lean is to obtain a perfect value with no waste. Lean projects come in many forms. One could focus on saving staff time, while another focuses on saving supplies. I've created a lean process in the past by ordering patient briefs that absorb more urine, thus eliminating the number of rounds that need to be conducted at night. Decreasing the number of toileting rounds could eliminate an entire staff member, thus leaning the process and saving the company money, not to mention patients being able to get more sleep at night. Another lean project allows staff time when transferring a patient from bed to toilet. So staff are required to use a gait belt when providing care, but sometimes they forget theirs at home when they arrive at work. We instead order a gait belt for every patient and place them above the bed. Not only does this process save time if staff need to search for one because they forgot theirs, but it also enhances our infection control practices when patients no longer need to share a belt with other patients. Six Sigma kind of fits into this as well. The goal is to reduce the amount of variation and increase quality control, which results in better patient quality. Companies could optimize their quality by implementing a combination of Lean and Six Sigma approaches. The focus of Lean is to decrease waste, while the focus of Six Sigma is to reduce the variation in quality control, or to keep consistency. Pay attention to how waste affects production, and you'll begin to incorporate both concepts into your practice. There are 5 Lean Six Sigma principles, which we will focus on in the next slide. A healthcare establishment should be there to work for the people. This means delivering the best care for the best value. Clear standards of quality should be developed and implemented into the culture. So focus on the root cause of the problem. Do not become distracted by the peripheral problems. Fixing the root cause may help fix other issues that erupt. You cannot expect staff to know the lean process or Six Sigma without proper training. Consider making a few of your staff members champions of the process by taking continuing education courses in the processes. They can then be the mentor that educates their peers and creates that culture of excellence. Be prepared to remove processes just recently implemented that are not working. This requires the leader to be flexible and responsive. Not everything works the first time we try it. Talk about OSHA a bit. So safety is regulated by OSHA, the Occupational Safety and Health Administration. Employers must be diligent in protecting their employers from injury. It's a requirement that employers need to discuss safety on a regular basis and make plans on how to decrease their level of risk. OSHA standards must be posted in easy to read places on the job, usually somewhere near the time clock. Employers are required to address the hazards head on. For example, it's not enough to just post a sign and hope that staff abide by it. There must be training, personal protective equipment, and accurate historical records of injuries. Although safety is a requirement in the workplace, employers should want to promote safety simply because it's the right thing to do. Workers' compensation injuries are expensive to pay out, and in some cases, they're lifelong. Reducing injuries and promoting safety will ensure costs are contained in the long run. Promoting safety starts with leadership. Clear expectations need to be established to ensure staff are participating in creating and sustaining a safe environment. For example, if a patient falls, the facility may require staff to use a mechanical lift to pick the patient up off the ground. If the staff decide to pick the patient up by themselves manually, re-education or corrective action can result. Expectations must be clear, and staff must participate to ensure a safe environment. Retraining should be conducted with all staff after major injuries so you can prevent reoccurrence. Finally, leaders should round on the units to identify the safety hazards and speak with staff about their own workplace concerns. Examples of injuries. So Sharp's injuries cause an immense amount of anxiety for healthcare workers. After a needle stick, frequent blood testing will be needed to identify infection. A positive blood test could result in years of costly treatment that would need to be paid for by workers' compensation. Review the Sharps policy and consider ways to promote safety. For example, retractable lancets. They will cost more than non-retractable, but the cost savings associated with fewer injuries will result in less money spent in the long run. In my previous facility, we were not allowed to use razors on patients to shave them. Instead, an electric razor was required, and no injuries occurred as a result. I want to talk about a couple theories and how they relate to nursing. Complexity theory is one of them, and it's just as it sounds. It's a theory that recognizes the complex concepts that affect our decisions within the environment. As nurses know, healthcare is not simple. The decisions we make as nurses are often based on the amount of time we have, the stress we're feeling, which doctor might be on call, and the factors affecting patient health. Understanding complexity theory will help relate scientific pieces to the nursing world. Dissipative systems are part of complexity theory, and these are systems that result from open systems or systems that require energy from the outside to function, so there's no equilibrium. A tornado would be an example of a dissipative system. In healthcare, a deteriorating patient is pushing energy into the nursing floor to make it function and react. This energy flows in a way that creates order amongst the chaos, I guess. So for example, nurses are prepared for the trauma patient who's coming in with multiple injuries. Now, most people out on the street would see this and panic, but the nursing team is highly skilled in this. They're able to use the chaos for order. Attractors and basin of attraction. Patterns that form spontaneously are known as attractors. The attractors are the patients coming into the system needing care, and patients provide energy to the system. Without energy from the outside, it simply would not function. Fractals. These refer to the repeating patterns viewed from different levels. A fractor is derived from the word fraction. The nursing field has many specialties, all of which dealing with different problems from the others. So the point is, do not view nursing from the viewpoint of one specialty. It won't be accurate. You have to view it from all the complex specialties put together. Chaos theory. So picture a pendulum moving back and forth. We can anticipate where the pendulum will move because it's a predictive and linear process. Chaos theory describes the qualities of the point in which order moves to disorder. That describes the unpredictable nature of nursing. You have to enjoy chaos to be a nurse. It's impossible to plan your day without interruptions or disorder, as you know from being a nurse. Within this, though, we begin to see the big picture of nursing. So we must look down and see the perfection amongst all the disorder. So within the bad that happens, we can still find good. Think of the code blue situations that we've been through as nurses. That adrenaline pumping experience is awful, but looking back, it helps us evolve into the better nurse that we are today with more experience to react to these situations. Chaos theory recognizes that change is inevitable. It will happen despite our best efforts to maintain that unchanged linear process. Any plan or process put forward will always have kinks requiring adjustment. Therefore, the final product you create will always be different than the original plan. It's how trial and error works. Communication and participation with all the staff is paramount in creating the best outcome. We must work to dissolve that old institutional age concept where we can plan everything out within our day. It doesn't work as nurses. Instead, change is inevitable and always moves. Nursing at the edge of chaos. So nursing at the edge of chaos is part of complexity theory, but it relates to the concept of chaos. The idea is that things are more apt to change or evolve if it's further from the equilibrium or perfection. So a patient that's upset or is about to assault staff, or a patient in distress and is critical, is at the edge of chaos. Now, when the patient dies, the system dissolves, chaos is done. But when intervention happens and the patient survives, that system just keeps evolving. So the more ill a patient is, the more potential for change within the system. This should be viewed as an opportunity within nursing. Simply put, the more problems that exist, the more change the nurse can work to make. This will result in more opportunities to learn and grow. Chaos is expected in nursing, and it should be embraced. Knowing the level of chaos and change that nurses will experience, they should learn from nursing school that chaos should be embraced. It's expected that the information learned will be outdated by the time that we enter the field. The processes that work today will not work tomorrow. Nurses will need to be part of committees to help solve the problems of tomorrow and bring the pendulum back to equilibrium. Consider the nursing process: assessment, planning, intervention, or implementation, evaluation. All these concepts are built on the idea that a patient is coming in with an illness and needs treatment or education. The patient in need of hospitalization is on the edge of chaos and needs intervention. Our field is built on chaos. The concluding points. So evidence-based care must be given to promote the best possible outcome in a cost-effective manner. Quality can be managed and tracked through various charts like run charts and control charts. Programs to improve quality include Lean and Six Sigma. Both have proven results in healthcare. Promoting employee safety means the employer and employee must partner to create an environment of safety. And the nursing field is built on chaos. The next few slides were the references used to create this PowerPoint.